I really appreciate this perspective because while it's been a long time since I've looked at the research, the last research I read said that physical mechanical restraints were equally traumatic for patients as seclusion. So there was no difference in the two being perceived as traumatic. So, of course, the research is suggesting that we try to keep our patients out of any form of restraint when at all possible. I found that really interesting because personally, I would think that being in seclusion would be less traumatic. However, I do recognize that all of this is inherently traumatic. Inpatient psychiatric care is inherently traumatic. But this is a good example of the fact that every patient is different, and because of what patients have been through and experienced, they're going to perceive this care differently, and they're going to perceive interventions, even when they are very restrictive interventions, differently. So I really appreciate you sharing, and I'm glad that you have been able to establish a plan for when these things happen, and you can be treated in the way that is least traumatic for you.